All right, let's dive into one of the most legendary project failures in modern history, the UK's absolutely massive attempt to digitize its entire National Health Service. We're talking about a grand vision for a 21st century healthcare system that, well, ended up as a multi-billion pound case study in what not to do. Let's get into it.
And you know what? Let's just start with a number that tells you pretty much everything you need to know. The final estimated cost of this dream, a jaw-dropping £12.7 billion. That is the price tag for a vision that went completely off the rails.
Now, to be fair, you have to appreciate the sheer scale of the ambition here. As this quote says, nothing like this had ever been tried before in the UK public sector. The goal was to basically leapfrog the entire NHS into the digital age. But, as we'll see, that incredible ambition also set the stage for a spectacular fall. So, here's our game plan. First, we'll look at the dream itself. Then, we'll perform an autopsy, really digging into the anatomy of the disaster. After that, we'll cover the aftermath and, most importantly, the key lessons for you as future leaders. And then, we'll hand it over to you for discussion. Okay, first up, a 12 billion digital dream. Let's take a closer look at what this National Program for IT, or NP-FIT, as it was called, was actually supposed to do. And the vision, honestly, was genuinely game-changing. Just picture this. Integrated health records for 50 million patients available to any doctor anywhere in the country. A nationwide e-prescription system to get rid of all that paper. Online appointment booking to slash wait times. And it would all be connected by this central data spine. It was supposed to be a total digital revolution for the NHS. But the reality? Well, that was a very different story. The program kicks off in 2002 with all this fanfare. But by 2006, one of the main suppliers, Accenture, just up and leaves. That's a massive red flag, right? By 2008, you've got leaders coming and going, delays piling up, and by 2011, less than a decade after it started, the whole thing is officially dismantled. A swift and absolutely brutal collapse. So now for the most important part, the anatomy of a disaster. Let's deconstruct the core failures to understand exactly why it all went so wrong. For those of you studying strategic management, this is the post-mortem. This is where the real learning happens. And the first critical failure wasn't about the software or the hardware. It was about people and politics. See, this whole thing was cooked up at the highest levels of government and then pushed down from the top. And that top-down approach, it turned out to be a fatal flaw. And this right here, this captures the central fatal disconnect of the whole project. The leadership in London believed a top-down mandate was the only way to get this done fast. But the doctors and nurses on the front lines, they just felt like these clunky, complicated systems were being forced on them without anyone ever asking them what they actually needed. It was making their jobs harder, not easier. This quote from Computer Weekly just says it all, doesn't it? Few projects can succeed over the outright opposition of the users. They never got the buy-in from the clinicians, and without the people who are actually supposed to use the system on board, it was doomed before a single line of code was even deployed. Okay, so the second major failure area was just fundamental project management stuff, planning and control. The ambition was huge, but the basic discipline needed to actually pull it off, it just wasn't there.
I mean, the project's foundations were just cracked from day one. You had timetables driven by political promises, not technical reality. Contracts were rushed through with incredibly vague requirements. The terms they gave suppliers were described as onerous and one-sided, which created conflict from the start. And maybe the most damning thing of all, there was no plan B. It was one single, massive bet with no escape hatch. Which brings us to our third core failure. The project completely lost sight of delivering actual value. It morphed into this massive exercise in rolling out IT just for the sake of rolling out IT, not for making healthcare better. You know, in strategic management, we talk a lot about benefits realization. It's just a fancy way of making sure a project is actually delivering the good stuff it promised. For NP-FIT, this was completely neglected. The goalposts shifted from let's improve patient care to let's get this software installed. And when you lose sight of the why, the what and the how just fall apart. So what was the real-world result of all these failures? Let's get into our third section, the billion-pound aftermath, to see the true, devastating cost of this collapse. This chart tells a pretty brutal story. That huge bar on the left, that's the 12.7 billion pounds they spent. And that tiny little bar next to it, that's the 2.6 billion in benefits they actually got.
It is, by any measure, an absolutely disastrous return on investment.
And the damage went so far beyond the money. Sure, billions of taxpayer pounds were written off, but maybe even worse, trust was shattered. For years, NHS staff were incredibly skeptical of any big new IT project. Critical improvements in patient care were set back by a decade. And NPFIT became the ultimate cautionary tale that gets taught in business schools everywhere.
But hey, a failure is only a total loss if you don't learn from it. So let's turn to the most important section for you, the lessons for future leaders. This is all about how you can avoid making these same multi-billion-pound mistakes in your own careers. And it really boils down to 4 critical rules. Number 1, center your stakeholders. You have to do change with people, not to them. 2, deliver value iteratively. Show small, quick wins to keep people on board. 3, plan realistically. A slow start is way better than a fast failure. And finally, number 4, always have an exit plan. Knowing when to pull the plug is just as important as knowing when to start. Okay, we've dissected the case, we've pulled it apart. Now it's your turn to put on your strategic management hats. For the next part of your session, you're going to apply this analysis in your groups. Here's your first question to tackle, and it hits on that first critical failure. If you were running the show, what specific, concrete things would you have done to get the doctors and nurses to buy in? And how would that have changed the entire outcome? Question 2 puts you right in the hot seat. Imagine it's 2007, the project is clearly failing, and you've just been put in charge of the rescue mission. What immediate changes do you make to pivot away from just installing software to actually delivering measurable value for patients and staff? For your third discussion point, I want you to zoom in on risk. Pick one of those major risks we saw, like a key supplier bailing on the project. How could better planning and governance have softened that blow? And what were the early warning signs that everybody apparently missed? And finally, let's bring this into the 21st century. NPFIT was a classic, rigid, top-down waterfall project. How might a more modern, agile approach, with smaller, iterative rollouts and constant feedback loops, have completely changed the story here? Could it have saved the dream? Okay, get to it. Thanks for listening.